organization is asking Kenya to exercise caution as it relaxes some of the regulations to contain COVID-19. WHO cites the recent drop in COVID-19 cases recorded in the country, adding that the country has also been conducting fewer tests without much contact tracing. These are concerns that the WHO says, if not addressed, could lead to a resurgence in spike and infections. I am now joined by Dr. Rudy Eggers, the WHO country representative for Kenya. Good afternoon, sir. Thank you so much for joining us on a news desk this afternoon.
Good afternoon. Good to be here.
Great. Straight on to the question of, are we finally winning the war against COVID-19? Are we finally flattening this curve, particularly in two counties, Nairobi and Mombasa?
We might be, but the problem is that we cannot be sure. So at the moment, the cases are in fact declining, and both in Nairobi and Mombasa and some of the other high-risk counties, the cases are becoming less. But the problem is that at the same time, we've been testing many fewer cases, and also the contact tracing has been declining. So the reason that we have been cautioning about calling this the peak or being past the peak already is that at the moment we don't have sufficient data to verify that. So we really call on the government, as has been done by His Excellency the President and CS Kagwe, that we reinvigorate really the systems that are in place to make sure that we know what is happening with the COVID outbreak across the country. That means the data collection at the local facilities, the transmission of the data from the county, the compilation in the Emergency Operations Center, the laboratories coming together so that we can get a full picture of what is happening.
Mm-hmm. How about your assessment of the other counties? Because in your statement you say that yes, Nairobi and Mombasa have recorded a decline in the cases, but this may mask other counties that are facing increases. For instance, if you could just talk about yesterday, the 30th of August, the statistics, the COVID-19 statistics, we had Nairobi leading at 81 cases, Kiambu 26, Embu 20, Makueni 18, Nakuru 15. Mombasa was actually at number 9 with 9 cases. So what does this say about the other counties? Kiambu, Embu, Makueni, Nakuru, Machakos, among others?
So as we've experienced in other countries, of course, different parts of the country are at different phases of the epidemic. So some of them started earlier and are maybe at the peak already, or we will have to determine if they're at the peak, and others are still increasing. However, there are also some counties that are doing very sporadic reporting, and these counties also of great concern. So if we look at a county like Kwale, there's very sporadic reporting. So we get a case now and then no more cases, then 3 cases, then no more cases. And that really is not the way an epidemic normally naturally progresses. So we've got a situation where we've got some counties that seemingly are having less cases, some counties that are still on the upward curve, and for many counties there's inconsistent data.
Mm-hmm. Let's talk about, again, back to the first question of if we are flattening this curve. If we could talk about the deaths, for instance, on August the 28th, we recorded 0 deaths. Yesterday was 2 deaths. So is this a good sign?
Definitely. I mean, definitely having fewer deaths is a good sign. However, as before, I think our statement would be that we need to verify that data by getting actually substantial more data to triangulate that. I think what would be very helpful is to actually look at the all-cause mortality. So overall deaths that are occurring across the country, across all the diseases that are causing death, and really look at that in comparison to previous years. If we look at countries such as South Africa, they have done that analysis and triangulation, and there were many more so-called excess deaths that were recorded in this period of COVID, and that gave them a much firmer feel of if the epidemic is increasing or decreasing. So here too in Kenya, getting the all-cause mortality data would really enable us to verify if this truly is a decline in mortality.
Mm-hmm. So at what point would we now say we are winning this war? Of course, factors like a vaccine put aside for now. At what point will we now say, you know, it's good news, we are winning the war?
I guess the main context would be if there's abundant and non-selective testing, and in that context of abundant and non-selective testing, we would find fewer cases being reported over a 2-week period or a 3-week period. That really would give us confidence. But also getting the all-cause mortality data showing decline, getting hospital admissions showing decline, all those additional data would actually help us a lot.
Let's talk about the relaxation of measures, because even in our spot checks in various stories that we've done, even here on KTN, we see people no longer wearing masks. You know, washing of hands after every 20 seconds is no longer being adhered to. Let's talk about your assessment on the relaxation of these measures.
So clearly those measures are still in place. So as far as the government directive is concerned, people should still wear masks and people should still wash their hands and practice social distancing. So in terms of the government directives, those are still in place, and we would really encourage Kenyans to actually follow those directives. We've got ample evidence across the world that things like wearing a mask actually do prevent this disease from spreading. So as we stand at the moment, there's absolutely no reason to counter that those measures that are already in place. In addition, of course, as we find ourselves beyond the peak, if we've got sufficient data, then we can talk about moving to opening of gatherings to a larger extent, the opening of schools, all kinds of things that can then follow on once this peak has been reached. But for now, really our plea from WHO is there are effective measures that are available and are in place by the government directives. Please, let's keep them on board and let's keep those measures in place, be it in matatus, be it in public places, be it in schools, be it in gatherings, wherever it is. These measures are there for a reason and are really protecting people.
You've mentioned schools, and initially a few months back we saw the Education CS, Professor George Magoha, saying that this year, the 2020 school calendar year, is lost, considered lost. But a few days ago, we've seen him say that perhaps schools could reopen before, January 2020. So in your assessment, when is, say, the best time, the safest time to reopen schools? Because there are people who say that we need to adapt, we need to learn how to live with this. We cannot continue having our children at home, but of course there's a risk of the COVID-19 pandemic upon the reopening of schools. Let's talk about that.
So we're actually supporting CS Education in this. I think he's made quite clear that as the epidemic evolves, everybody's learning, including the education sector. So as the epidemic evolves and as we get to understand how many cases there are we increasing, are we decreasing, these are all features that can come into the discussion and the decision-making about the opening of schools. In addition to that, it's not only the flattening of the curve that will determine that, but also the readiness of the education sector to accommodate these measures. So the ability to have scholars sitting at distance from each other, the wearing of masks, all those things should be taken into consideration. And we think CS Education is expressing the flexibility that is needed in this outbreak. As we see progress, as we see changes, our regulations and our directives too should change. And by the way, that is not only in becoming less stringent, but should we find that in fact we do find more cases, it may be that we have to go to something that is more stringent. And I think this flexibility is what we all are learning.
Indeed. Dr. Rodi, before we wrap up, let's talk a little about Tanzania, because Tanzania, our neighbors here are living life, as usual. There's nothing different from them. They still have huge crowds in stadiums. They're living life normally, I would borrow the words of Health CS Mutahi Kagwe. What exactly is the situation like in Tanzania? Perhaps what is it that they know that the rest of us do not know?
Unfortunately, I'm not mandated to talk about the Tanzanian situation. So basically, the only thing I can say is that the Tanzanian government has not reported the cases of COVID to WHO as is required by the International Health Regulation for their own reasons. I don't know how things are going in Tanzania, if there's actually increasing epidemic or decreasing or none at all. And we do not have the information in WHO to actually make any statement about that.
Okay, let's get your closing remarks now, Dr. Rudy.
So I think our closing remarks is we are actually eagerly anticipating that the number of cases are declining. So it is an encouraging sign, really, that the number of cases over the last 2 weeks or so have been declining. However, we would like to warn against an early complacency. We believe that we need much more data and also much more testing before we can really firmly say that the cases are declining. And only then can we talk about the removal of public health measures. In the meantime, we would call on everybody from the ministry, but really also the public and the media as well. Let's keep those measures that the government has put in place. Let's follow them and let's prevent this disease getting further out of hand or creating a second wave in Kenya. Thank you so much.
Indeed. Thank you so much to Dr. Rudy Eggers, there, the WHO country representative for Kenya. Thank you, Doctor, for joining us on News Desk this afternoon. Let's move on. Coffee